What? Is it dead?
No, I don't have internet.
You should.
All right, I think we'll go ahead and get started. Thank you guys for being here today. We got a full lineup. We'll have a special guest today, Dr. Rekha Danko, who's a member of the District Board of Health and serves as a hospitalist for Carson Tahoe Health. We invited her to share her experiences to media because she has a remarkable background in Northern Nevada as both a public health professional as well as being on the front lines, the COVID-19 response. Dr. Danko earned her medical degree at the University of Nevada, Reno School of Medicine, where she completed her residency in internal medicine. She is both board certified in both internal medicine and addiction medicine. Dr. Danko is formerly the Chief Medical Officer for Northern Nevada Hopes and is currently an assistant professor for the University of Nevada School of Medicine. We'll lead off with Dr. Danko and then have District Health Officer Kevin Dick join immediately after. So Dr. Danko, if you're ready to go, thank you for being with us. Hello,
thank you very much. Can you hear me okay? Can I get somebody to say yes to that?
Yep, we hear you loud and clear.
Okay, great, thank you. So thank you very much for the invitation to the conference today and also for the introduction. I do currently work as a hospitalist at Carson Tahoe Hospital, and a hospitalist is a physician who sees patients who are hospitalized, as well as I also follow patients in the post-acute facilities in Carson City, such as the nursing homes and the rehabilitation centers. So I would say working in the hospital this year has certainly been different than working in the hospital in my previous years. Since the start of the coronavirus pandemic, we have certainly seen a shift in guidelines both in healthcare facilities and in our community. And we are certainly taking strict precautions in the hospital as well as in the nursing facilities to keep our patients, our staff, and our caregivers safe. And these enhanced precautions and cleaning protocols and prevention strategies are important. And I think it's important to let the community know also that people should feel safe to seek help in the ER and in our medical community as a whole, and not to avoid places like the hospital during this time. With respect to trends in coronavirus, I would say in my experience, we are seeing an increase in coronavirus cases now compared to March and April. And Carson Tahoe Hospital continues to monitor the trends and also has a surge plan drafted for various levels of sick patients and increase in the number of patients needing beds in the hospital. We've also seen an increase in patients who are seeking care in the emergency room and in the urgent care setting for cough and fever-like symptoms also. I would say that hospitals and facilities currently still remain in controlled access mode by allowing certain times for visitors or not allowing visitors at all. And the reason for those strategies is also to prevent the spread of infection, to allow safety for patients and staff and for family members and friends. So with respect to PPE, which is personal protective equipment, I know that many times we hear nationally and internationally that there are shortages, but I will say that in my personal experience on the front line, I have always had adequate masks and other protective equipment necessary to care for those patients, and those have been readily available to me in providing clinical care to patients with coronavirus and other patients also. So how can the community help during the pandemic? I think we stress all the time through the health district that wearing masks and doing social distancing is a very important component to this. It's important that if you feel unwell, staying home is also a strategy. And people can spread coronavirus infection without having symptoms of coronavirus. In other words, you could spread the infection before you know that you have symptoms, before you actually know that you have infection, or even asymptomatic, meaning that you never manifest any of the symptoms of coronavirus. So I think the wearing of the masks is a crucial component, and we can't stress enough how that will decrease not only the amount of sick people in the community, but it will decrease the burden on the healthcare system, and it will also decrease the spread of the infection to more vulnerable populations, such as those who are elderly or those with underlying clinical conditions. So I think as far as practicing in the hospital, we do see a higher severity of cases and wide-ranging complications, anywhere from organ failure to requiring dialysis, certainly severe lung infections, and overwhelming body infections like sepsis that actually creates low blood pressure and other complications to patients also. We do closely follow recommendations for medical therapies, and I will just make a quick comment that currently there are no FDA-approved medications or specific treatments for coronavirus infection. Hydroxychloroquine has unknown efficacy and is really a medication reserved for clinical trials at this time. We do use a medication called remdesivir, which is a broad spectrum antiviral medication that is also helpful for patients. We do use this in the hospital, both in the intensive care unit and in the regular medical wards as well. With respect to additional treatments, we provide lots of supportive care. And there is some data that it being in the prone position or being in a position where you are on your stomach or on your side can be helpful to patients fighting coronavirus. We do promote this in the hospital setting by placing patients face down rather than on their backs. And it would be important to note that if people have coronavirus infection at home, that this is certainly a strategy that could be utilized, as well as moving around, because moving around helps the oxygenation of the lungs and helps the lungs to stay healthier. In addition to that, we also have used convalescent plasma, which I will say a few words about, that this is a type of a blood product that contains antibodies. Antibodies are proteins that are made by the body to help fight infection. And by giving a plasma transfusion to a patient, we are hopeful that those antibodies from someone who has already recovered from coronavirus infection will help strengthen the immune system and the body of someone who is currently fighting coronavirus and lessen the severity of the illness and help them fight that disease. So what else can we do to stay healthy? We do recommend healthy lifestyle choices with respect to diet and exercise and getting plenty of sleep. Of course, the hygiene recommendations for hand washing and cleaning the surfaces, especially common touch surfaces like doorknobs and refrigerator handles and bathroom surfaces. And we also definitely recommend wearing masks and promoting the social distancing. To help the lungs optimize and stay as healthy as possible, we recommend not smoking and not vaping, because those are toxins to the lungs that don't allow the lungs to heal nearly as well or be in such good shape to fight something like coronavirus if it does come into play. So those are my initial thoughts, and I'm happy to take any questions from the community.
Thank you, Dr. Danko. A lot of information there, a great resource. Thanks again for coming on. If you have any specific questions about anything she said, feel free to ask them right now. All right, no questions for Dr. Danko. Does anyone? Last call? If you have one, we can also. She'll stick around, so if you have one for later, that's fine too. And if you have questions and for some reason can't connect or having audio issues, feel free to leave them in the chat box, and I'll get to those at the end.
I do have one quick question. This is Ann Jeanette from the Reno Gazette-Journal. I was wondering, as parents are looking towards schools reopening, what would you say to parents concerned about the health of their children going back to school or not going back to school? What kind of advice do you give on that front?
Sure. I think, oops, I'm not sure. Can you guys hear me okay?
Yep, you're good.
Perfect. With respect to going back to school, I think that those guidelines are potentially changing, and certainly that's not my area of expertise, but I think that if we can promote within the community those healthy strategies, social distancing, wearing masks, then we can make a global impact in our community with respect to transmission of this infection. And with that being said, I think the schools will also have enhanced protocols also to keep the children safe as well.
All right, good question. Thank you, Dr. Denko. Any other questions for Dr. Denko? Okay, we will move on to Kevin Dick, District Health Officer. Kevin, if you're ready, please go ahead.
Yes, thank you, Scott, and thanks everybody for joining us today. I do have some updated information on COVID-19 case counts for Washoe County. Sadly, we're reporting one additional death today, a male in his 70s with underlying health conditions. Additionally, we're reporting 94 new cases of COVID-19 in Washoe County, and we also have 50 additional recoveries that have occurred. So that brings our total COVID-19 case count in Washoe County to 3,810. Our deaths are at 99 to date for Washoe County. With the 50 recoveries, our recoveries are at 2,562. Unfortunately, our new cases are greater than our recoveries today, so active cases have increased by 43 to 1,149. We currently have 81 individuals hospitalized, and we have 289 individuals total that have been discharged from hospitals to date. We continue to have high numbers of test results reported on a daily basis, and as of the reports through the state dashboard this morning, we had 66,197 total tests run in Washoe County. That's an increase of about 1,278 from yesterday, and we've been averaging about 1,300 new tests results per day so far through the month of July. I would add that we're continuing to operate our post. We've operated our post Monday morning, this morning. We're adding tomorrow, and we'll be testing on Friday. Next week, we've got a 4-day schedule of Monday, Tuesday, Wednesday, Thursday, and we'll be moving to try to have testing available all 5 days during the week to have people have access for that testing. But I would ask that if people are not going to show up for testing and they're scheduled for testing, please notify us and cancel your appointment for being tested. We're having a high no-show rate of people that are not showing up as scheduled at the post, and that basically takes that testing opportunity away from somebody else. So please do access our post for testing, but if you are not going to make your scheduled time for testing, please cancel in advance. Let us know so that somebody else can have that spot available. As far as the hospital bed capacity, we still remain good. We have 79% of acute care beds occupied in Washoe County. We have 54% of all intensive care unit beds occupied, and 14% of ventilators that are in use. So one of the things that I wanted to highlight today is a study that was released yesterday through the CDC Morbidity and Mortality Weekly Report, which provides a good example of how masks can help to prevent the spread of COVID-19. I believe the Reno Gazette Journal actually picked this up and ran something on it. So appreciate that they're working to inform the community on this. This was a case that occurred in Springfield, Missouri, or a situation in which two hairstylists were infected with COVID-19 and were tested positive for COVID-19. Both of those stylists did work while they were symptomatic and awaiting the test results. And between the two of them, they exposed 139 clients that they had been working with. The hairstylists and the clients were complying with the Springfield ordinance and with recommendations for wearing masks. And of those 139 clients, none of them developed COVID-19. So that's 139 all exposed for more than 15 minutes in close proximity. That's a huge case count, contact count for those two cases, and none of those clients became infected. We also see from what has occurred in other countries that have mandated people wearing facial coverings that they have been able to control the spread of the disease. Oh, and thank you, Scott. There's a nice graphic that goes with this as well that CDC put out. But we have seen in other countries where the face masks are mandated that it has worked to help control and suppress the spread of the disease. And they've also experienced significantly lower mortality rates in those countries because they have less people, fewer people developing the disease. So with the 1,150 approximately active cases that we have in the community, I want to remind the community that we still have a very large number of active cases. From our seroprevalence study, we understand that we probably have about 5 times that many cases. They just haven't all been confirmed through laboratory testing. So we have a community spread of COVID-19 going on, and I would echo the message from Dr. Danko regarding how important it is that people wear masks and maintain social distancing in order to protect yourselves and protect others from getting COVID-19. The testing and the contact tracing is a tool that we can use, but that's only effective if everybody is working together to try to keep COVID-19 at low levels in our community by following those practices. So I also wanted to add, we've been working hard on the staffing for long-term staffing of our call center, post testing, and contact tracing activities. And so over the last 2 weeks, we've brought 30 additional staff on board for case investigation and contact tracing. We're also continuing to bring in new staff for the call center. I had 4 new staff come in this week for that. We're hiring per diem nursing staff to assist with the testing through the post, and also bringing on additional ancillary staff to help with the post operations. And I would remind everybody as well that we're working with the University of Nevada, Reno, Nevada Public Health Training Center for bringing on a lot of those staff. So if there are anybody in the community that's interested in those positions, they should go to the website at UNR, the Nevada Public Health Training Center. They're also assisting with staffing for the state, Carson City Health and Human Services, et cetera. So there are those opportunities available. With that, I'd end my briefing and open it up for any questions that people have.
Go ahead and fire away with questions for Kevin, and also Washoe County Incident Commander Aaron Keniston is available as well if you need him.
Hi, Kevin. It's Siobhan from the RGJ. If schools were going to open, say, on Monday, would you think, what would your opinion be if schools were opening Monday based on where we are right now?
I would be concerned if they were opening right now with the number of cases that we have. I know the school district is working very hard and thinking and being very thoughtful in how they're approaching bringing children back to schools. It's a difficult decisions that are being made, and I don't know that anybody knows what the right answer is. As the district health officer and responsible for the health of everybody in our community, I have a tough time imagining that I wouldn't be concerned, no matter what the levels were, with schools reopening, because it is just creating more interactions in our community. But I think that they're working hard to ensure that the measures are being taken to prevent the spread, with the mask wearing and the social distancing, all of the plans that they have done. And I think what we need to do is, once they are open, we just need to continue to monitor the situation and assess how it's working.
Do you think we'll be in a better spot in a month when schools open?
We have the possibility of being in a better spot, and that will be dependent on how we all work together as a community to suppress the spread of COVID-19. And so we know that if people are wearing masks, and we have a high percentage, 95% of people wearing masks as they're supposed to, that will bring our rate of transmission down below 1. That's less than one person being infected by each person that does have COVID-19. If we can achieve that, then with that transmission rate of less than 1, that will lead to a declining, ever lower number of COVID cases in our community, and that's the path to our success. So I can't tell you where we'll be, because it's dependent on what each person in our community does to work together to stop this. But I can tell you, if they do work together and take those actions, we will reduce the number of cases that we have in the community.
So it's about a month out, right? If everyone's really good the next couple of weeks, then we would see results in a month. Like, we're about a month out from how it works. I'm just trying to.
Yeah, it's not a precise science with the timing. 2 weeks to a month time frame. We have had the average daily, the average daily case count, 7-day rolling average, has come down fairly well since the 4th of July holiday. We had approximately 90 new cases occurring today with that rolling average. As of yesterday, it was closer to 60 new cases today. Those are still high numbers, but at least that's moving in the right direction. I'm hopeful that perhaps that is something that we're seeing because of the governor's mask mandate. However, it could also be tied to what the timing is following the Father's Day holiday. And I expect we're probably going to be seeing some impacts from 4th of July holiday gatherings coming up. I would emphasize that no matter how many requirements we place on people when they're out in public, and on our businesses for their compliance with social distancing and mask wearing, we're really not going to solve this unless people are also using those same practices when they do have gatherings, and if they're not trying to limit the number of gatherings that occur and keep those gatherings small. We're really seeing a lot of cases that are coming out of those private gatherings and parties.
Hi, Kevin. This is Jonathan Wright from the Gazette-Journal. Hello. The RGG has learned that there are certain bars in the county that never previously served food that have now brought in food from the outside to get around the governor's directive that they close for safety best practices. Does the health district have any position on this activity, either from an enforcement or best practices standpoint?
We are not part of the enforcement of the governor's directive. That's the state occupational safety and health, and it was also included in there as far as local authority licensing and law enforcement.
Right.
As far as a stance on it, I don't know that I'm well enough informed on what's occurring with those bars. I believe I had heard that there were bars that were using that to be able to do curbside. But if that's the case, well, it may be a creative way of working in compliance of the governor's directive. If it's curbside pickup, I don't really see a huge public health impact from that. I guess it might be more concerning if it's indoor dining and it's a small bar facility, but I don't have the specifics.
So let's just take as a given that that is occurring, because it is the bringing food, indoor dining that did not previously occur. What is your position then on safety?
I think it would need to be a look at, what's the difference of as far as what's occurring there with the potential for spread of COVID-19 versus an indoor restaurant setting.
Mm-hmm.
And I think if they're under the same parameters as far as the social distancing, et cetera, then it probably is a similar potential for spread as what's allowed under the governor's orders.
Thank you.
Any more questions for Kevin? All right. Well, thank you all for joining us on this call, and we'll be back next Wednesday at 11:30 a.m. and we'll have today's release out here in the next hour or so. Thank you very much.
Thank you.